Okay, so I want to go ahead and welcome you all. Thank you for joining us today. Our webinar today is Realities of Medicaid, Understanding What's Covered. The Missouri Coalition for Oral Health is a 501c3 advocacy organization focused on policy and systems change to increase access to oral health services for all Missourians. You can learn more about MCOH and other upcoming events by visiting our website, Facebook page, Twitter, and LinkedIn. I am Jessica Emmerich, the Dental Medicaid Facilitator with the Missouri Coalition for Oral Health. With the help of the Missouri Dental Association and MO HealthNet, we've been working with dental providers to increase Medicaid participation. Through that work, providers have brought to our attention barriers that may prevent them from providing the necessary care for Medicaid patients. MO HealthNet processes and procedures may differ from what providers are used to seeing. Today, we have Amanda Behrendorf, the Education and Collaboration Manager with MO HealthNet here to give providers a look at what they need to know to get started with MO HealthNet. During the webinar, attendees are muted, but you can submit your questions through the chat or the Q&A boxes. Those are both at the bottom of your screen. Today's webinar is being recorded, and you'll be able to find the recording on the Missouri Coalition for Oral Health website following the presentation. At the end of the presentation, I'm going to put a survey link in the chat box. This link will also be sent out in an email following the webinar. Please take the time to complete the survey. Your feedback will help us continue to provide webinars and trainings that are beneficial for you. So with that, I'm going to go ahead and turn it over to Amanda Behrendorf.
Thank you, Jessie. Thank you guys for attending today. I'm hopeful that I will be able to provide some information that will be helpful to you, as well as clarifying some of the information you already have. First, I'm going to share a beginning of a PowerPoint with you to kind of talk about MO HealthNet, types of coverage, that type of thing. During the presentation, feel free to put questions in the chat. Jesse, I'll bring those to my attention. I don't mind answering questions throughout the presentation, but if there gets to be too many, then we'll hold some of those questions for later. But please feel free to ask any questions as we go along. I'm going to go ahead and share my screen. Oops. I guess it's showing that way over there. All right, so basically, Jesse, do you want me to switch the view here? Or I can get through some of this way, I guess.
Whichever way you prefer.
All right, well, I don't want to waste time. Okay, so I'm going to just talk about a few things. Eligibility, which is managed care versus fee-for-service, the different benefits that are available for participants with MO HealthNet, the dental provider manual, and I do have some claim samples and things for you that you can use later on. So first, who is eligible for MO HealthNet? So there are several different ways a person could qualify for Medicaid. So there'll be seniors ages 65 and older, parents or caretakers with a child under the age of 19, child age birth through 18th, women 18, and then women with no health insurance, 18 to 55, adults without disabilities, 19 to 64. That is the new adult expansion group. We expanded Medicaid to include these individuals. Then we have pregnant women, women with breast or cervical cancer, people with disabilities, and blind or visually impaired individuals. These are just how the types of groups that would receive Medicaid or be eligible for Medicaid. Now, there are two different types of MO HealthNet coverage. You have what's called fee-for-service and what's called managed care. So fee-for-service means the participant will receive their services and benefits through MO HealthNet directly, so straight from the Medicaid agency. Managed care, the participants will receive services from one of our 4 managed care plans. So that would be for children, pregnant women, newborns, and families. So the fee-for-service population would be people with disabilities, seniors, blind, or women with breast or cervical cancer. So anybody with Medicare, they would be in the fee-for-service population. All right, so the 4 managed care plans. We have Healthy Blue, Home State, Show Me Healthy Kids, and United Healthcare. If you're not familiar with Show Me Healthy Kids, that is a new specialty plan that specializes, well, basically the foster care, adoption subsidy, state custody kids are all put in Show Me Healthy Kids, which has additional wraparound services to provide extra benefits around behavioral health, among other things. So if you ever see that when you're looking at eligibility, that's kind of the reason they're in that plan. So when a provider looks at eligibility, you'll be able to tell which one of these plans they are in. And like I said, children, pregnant women, newborns, and families will be in one of these 4 managed care plans. So your benefits should differ or can differ based on how a participant qualifies for MO HealthNet. So I kind of explained a little bit about the different categories. So when somebody qualifies for MO HealthNet, they're assigned an ME code, which is their medical eligibility code. And each one of those medical eligibility codes has a description, right, next to it. And then it gives kind of, it'll tell you whether that person receives the higher Medicaid benefit, like a limited benefit or a comprehensive benefit. So this is just an example of some of the ME codes. On here, you can see, if you can see it close enough, where it says like 03, that's aid to the blind. And there's other ones down here. So it'll tell you what all of the different ones are. There is a resource. This comes from our provider resource guide. There's a hyperlink here, and I'll provide Jesse with this PowerPoint later. All right, so there's 2 different dental benefits. There's a comprehensive benefit and a limited adult dental benefit. Both groups receive, exams, imaging, there's extractions, restorations. Now the comprehensive group, those individuals will be eligible for like root canals, dentures, additional benefits. This is just a example of some of the things. Now the provider manual will go into detail and tell you what exactly is covered for each group of people. Now, how do we break that down? We've got comprehensive, which will be participants under the age of 21, individuals who are pregnant, blind, or in a nursing home. They're going to receive that higher level of care, so the comprehensive benefit. Participants who are over 21 who are not pregnant, blind, or in a nursing home will receive the limited benefit. Even with the limited benefit, they're going to have a dental benefit. It's not, just for trauma or underlying medical condition. They actually have codes that they are eligible for. Now, I'm going to escape out of this, and I'm going to take you to our provider page. That's going to give you like all the different resources and things. Now, if you're an established provider with MO HealthNet, and I'm assuming many of you are new providers or thinking about signing up with MO HealthNet, but if you are already a provider, you may use EMOMed to check eligibility. So this is where we go to check eligibility, as well as submit fee-for-service claims, and there's other types of things you can get into on EMOMed. But the reason I brought you here is I want to help you get to our provider page. So over here under external links, it's going to take you to our provider page, which will talk a little bit about fee-for-service versus managed care. And if you were to click here, it'd take you to the managed care page. Maybe, it seems like it's slow. There you go. That gives you links to all the plans and the information about the plans. Now, this is what I kind of want to show you. I'm just going to give you, some general information about what resources are out here. We have our provider bulletins, hot tips, the provider manuals. And I'll kind of just touch on a couple of these. I won't go into great detail, but I want to spend a little bit of time in the provider manual, and I hope you guys will have some questions. The provider bulletins, this is how we introduce new policy, changes to policy, clarification of policy, new rate changes, things that are important a provider should know. We'll send out a bulletin, and these are published online. I mean, this just is an example. This talks about crossover claims, which really wouldn't pertain to a dental provider. But this is just an example of a bulletin that's out there. We also have an index. You can click on this and search by provider type, and they'll show a list of all the bulletins that apply to a dental provider. The same thing is kind of true with hot tips. Hot tips aren't necessarily introduction of policies, but it could be talking about processes or additional resources for you. Kind of just short little blurbs about different things. Like this talks about non-emergency transportation. We recently put a PowerPoint out there and had a training about this program so that providers knew it was available. So that's just an example of something we put out on a hot tip. Now, there's also an index for these as well. Okay, so like my favorite thing is our provider manuals. Now I want to bring this to your attention. Up at the top, there are links to the Home State Health, Show Me Healthy Kids, Healthy Blue, and United Healthcare manuals. So this information or these links will take you to their website. Because if a participant is enrolled in a managed care plan, the providers actually have to work with the plan on coordinating their benefits, whatever's covered by the plan, and you have to bill them directly. Now, they should cover the same benefits MO HealthNet covers, but some of their processes could be different. Their timely filing rules could be a little different. But what's cool is that we did put a link out here to their provider manuals so that you'll be able to get in there and look. Jesse, it looks like we have a question. Do you want me to look at it?
Sure. Let's see. Can you go back to how you got to this information from the mydss.mo.gov homepage?
Yes. Let me see where. Okay, so what I did was went here to the EMOMed portal. If you're not familiar with EMOMed, the actual website is dss.mo.gov. If you get to this page, like say you don't remember all the rest of that, which I understand because there's a lot of information, you can go to this page, you click on division, go to MO HealthNet division, and go to provider information, and then I'll take you there. I mean, if for whatever reason you get out there and you're trying to find it, you could just go to dss.mo.gov and get to where it talks about MO HealthNet, and you'll get to this page. Did that help? Did that help you and answer your question?
We can put a link to it in the chat also, or we can send it out with the email that'll go out after the webinar.
Great. Awesome. Sounds good. All right, so I clicked on provider manuals, and then I just wanted to let you know that their manuals are out here. This is fairly new. Now, previously, if anyone has experience with our provider manuals in the past, a provider manual could be like 400 pages. They were really long. There were several sections within that manual that really were overarching that would apply to every Medicaid program. So we considered those general sections, which means they are not program specific. It's just general information. So we pulled those sections of the manual out. We made a general sections manual, which basically pulled all that and made it its own place, right? Then we have a program specific manual, which is dental, which is amazing because it cut it down to 134 pages instead of like 300 and something. We also rewrote the provider manual, or we reviewed it. We did a lot of edits and changes in hopes that it would make it easier to understand, as well as, clarify things, update links and forms, all kinds of different things in the manual. But we've made it a lot more user-friendly so you guys can find information better. Now, because this is such a big change, if you're in there navigating the manual and you come across something that just doesn't look right, please send me an email, and Jesse can give my information out. I'll try to put that in the chat later. And let me know that there's something out there that you think needs to be changed or clarified. I'm going to look in the chat and see what questions there are. Oh,
I just put the link.
Okay, great. Awesome. Okay, so this is the dental provider manual. And here's our table of contents. Previously, there was like 23 sections of the manual. So now we've got it down to, I believe, 5. Yep, 5. So it's so much better. The sections that I would concentrate on would be section 2, which would be benefits and limitations. This tells you what types of services a participant would be eligible for. And a section later in the manual, it's going to give you all the CDT codes. So basically, I've told you that participants that are under the age of 21, blind, pregnant, or in a nursing home receive a comprehensive benefit. And then there's a limited adult dental benefit that has less services. If a person needs additional services that are not in one of the benefit packages, they could potentially access those services by using like a referral from their primary care physician. And some of the things that they may approve additional benefits for is if, like, say they have chemo, their diabetes, cancer, does underlying conditions, or for a trauma. So this right here is just an example of what we would be looking for to see if we could, if you can justify that this person is truly medically necessary for them to have these additional services. Dentures is not one of the things that we will consider through medical necessity, but there's other things. This process was used more frequently prior to the limited adult dental benefit. The limited adult dental benefit was introduced in 2016. So we've seen this a little bit more now. There is a benefit for them, which is helpful. I'll just scroll down through some of these things. Now there's lots of different things that are covered, but something that providers ask about frequently is, say you are providing a custom service, like there's something that's only for that participant, like dentures. You make a pair of dentures for someone, they are not, somebody else can't use them. If that person had eligibility when you started making that, or you seen them and ordered the dentures, started that process, and they lost eligibility by the time that you go to place the dentures, MO HealthNet will honor that payment. And the same is true if someone passes away, we'll honor that payment for that specific service. Now, the managed care plans should do the same, but just so you guys know, if it's custom made item or service, we're going to honor that even if they lose eligibility or change eligibility. Like an example, like pregnancy, participants that are pregnant would be eligible for dentures. Say they had complications during their pregnancy, and actually it shouldn't affect it too much anymore, but for whatever reason they lost eligibility or it changes and they go into more of a limited coverage, if long as they started it before that happened, then it's okay. Now, if you guys haven't heard yet, the women's pregnancy coverage was extended 12 months postpartum. So previously, after a mother gave birth, they'd have 60 days of benefits at the same level of pregnancy coverage. There was a bill passed that now it's extended it to 12 months postpartum, which is awesome because not only do they receive Medicaid benefits, they receive the higher level of benefits. So say there are special things like a pregnant person receives that comprehensive benefit. So say she had to have root canals and maybe dentures or different things, right? She would be eligible for that for an additional 12 months, which I think is pretty awesome. I think I'm going to just go to section 5 and kind of go into the services that are covered. All right, so we have a new table out here. Previously, if you're familiar with MO HealthNet and how our manuals looked before, we had a table for the limited adult dental benefit and we had a comprehensive table. The limited one was in section 13 of the manual, and then this was what we called section 19. We combined it and hopefully made it a little bit easier to navigate so you don't have to go 2 different places. So all the services listed in this table, participants under the age of 21, blind, pregnant, or in a nursing home are eligible for. And of course, you got to consider some of these things. Like if there's an age limit, then, you know, a child under 2 would be eligible for this service. But you can go down through here and it will give you that information. Now, there is a column over here for limited adult coverage. This is going to tell you what benefits a participant who is over 21, not pregnant, blind, or in a nursing home would receive. They would be eligible for, like example, DO 140, the limited problem-focused exam. Now, this exam is one time every 2 years. Now, you may notice that DO 120, there's no X there. So the periodic oral evaluation is not covered under the limited adult dental benefit at this time. That is something that is being looked at right now. But you could, you know, we call it a self-pay agreement where providers would bill the participant, let them know that, you know, this is their responsibility, but there are other services, right? And we can go down through here and see, but they're all have X's next to them of the services that are covered under limited. Does anybody have any questions so far? All right, so I wanted to let you guys know that there was a table out there. Now, there are other things in the provider manual that are important for you to know. Now, a lot of this stuff applies to fee-for-service. Okay, so some of the prior authorizations that I'll talk about, just kind of some general information, that is going to be specific to fee-for-service. But the table that discusses who gets what, the coverages, the CDT codes, that applies to everyone. It's just, you know, the plans, they use that information to provide the benefits for those participants. Looks like there may be a question.
Yes, there is. The question is nitrous coverage. When is it covered and when is it not?
Now, with fee for service, our limit, like our stuff is a little bit more lenient. Like I think we don't require prior authorizations for nitrous. Now the managed care plans have different rules. And I can't speak to their rules, but at one point, I believe they had like some type of questionnaire that you had to fill out to justify the need for that. So I believe it's for children with like anxiety, I think special needs adults. Actually, let's look in the manual real quick. I think it might be under sedation, possibly. And it might not be that one.
And then also there was a question if it needs to be pre-authorized, which you already addressed, and does it need a narrative?
You know, and I'm thinking, I'm assuming you're dealing with children or special needs adults. Special needs adults, I don't believe that would need to happen if they're in fee for service. There shouldn't be a prior authorization requirement. If they're in a managed care plan, you have to defer to the managed care plan because like they have different rules. Like we require PAs for certain things and they may not, and vice versa. It is my experience, just based on conversations I've had with providers, that they probably do require that information. But really, the answer is you have to check with the plan. Hopefully that answered it. Did that answer your question?
There were a couple of them here if you want to answer them real quick.
Okay.
Yes, it says that they answered that question.
Okay, so how do you find all frequency limitations? So frequency limitations should be in section 8, or not 8, sorry, section 5 of the manual. Now, some things aren't spelled out, right? Let me go here. We tried to add them in here. So like the periodic oral evaluation is twice within a calendar year. I had them add this problem focused one because before it just said no no limitation. There was nothing written there. So actually DO 140, which is a problem focused exam, is one time every 2 years. And that's regardless of eligibility. Like it could be for a child, it could be for a nursing home person, doesn't matter. It's one time every 2 years. So we tried to add a lot of this stuff in here. And you know what? There is one thing I want to bring to your attention. This is actually a big change, and I'll go to where it's at in the manual. DO 150. Previously, I mean, it says one consult per participant, so it'd be one per participant per provider, period. Like people used to interpret that as like a lifetime. Medicaid has changed. We changed the definition and how we're going to cover this code. It's going to be one time every 2 years. And it does not have to be a new patient. It could be an established patient. So they're going to go with the definition in the CDT code book. And I'll show you, let me see if I can find it real quick, where it's at in here. I'm glad you guys asked some of these questions because that helps me help you. Here we go. So comprehensive oral evaluation, DO 150, reimbursed one time per dental provider. This exam can be reimbursed every 2 years. So I believe they're going to update the manual again and add some additional information. But in the definition that we looked at, it said it could be a new patient or established patient. And it talked about if there was some type of change in their condition, right? Their medical condition. So if you look at the code book, that's what we're going to go by. All right. So that was a pretty good change, a significant change with MO HealthNet. I'm going to open up that. Hopefully, to explain some of this. So on the procedure code list, section 5, what is the description of the support column heading? I'm glad you asked about that. Okay, so we were trying to, I guess, make it easier to understand some of these things. And actually, there is another updated version of this that we're working on putting out there because we found some things that needed to be specified a little bit better. But I'm going to explain it to you. So here's like the little key. So it's like the procedure code, description, age, maximum allowed, trauma. Okay, so here's the ones that are kind of out there. So we got trauma and medical condition. All right, so this is basically saying if this code is not covered. So if I go down there in the chart and it's not covered for adults, how can an adult qualify for that, right? A person over the age of 21 not within that special category, then they may qualify using that process that I was telling you, like their primary care physician could write a referral saying they have an underlying medical condition or trauma. So in the column, like down on this chart, that's basically what it's saying. Then the support, this is basically the same. So like a service may be covered if it's billed with in conjunction with a trauma or medical condition. So it's very similar. And like I said, this is going to be updated again, where it kind of spells this out. The new definition here says if the service is not covered, because some down here, if you look, it's going to say support or medical trauma, even when it's covered. So like you see, it says trauma medical condition. This is saying if this service would not have been covered for like say adults, then it would require that. We tried to change the manual and have some of this removed, but there's some reason why they have it in there. I don't know if that means if for whatever reason they change some of these coverages, that it's still going to allow people to request it. So here's an example, DO 160, it's not covered for adults, but it potentially could be considered if they have medical trauma or trauma or a medical condition. The same with support. If we go down here and I find one with support right here. I mean, this was a general one. How about down here a little bit? This one. So like topical fluoride is not covered for participants. I believe it doesn't give you an age limitation here. This might be something that's covered for like, if for a reason, a medical reason. I think we talk about this with like special needs adults, different individuals that may need this that fall outside of this here, but there's a little difference. All right, hopefully I answered that question. I know it was a lot of back and forth. Like I said, we're working on clarifying this. I wrote some new things in here to help providers understand it a little bit better. So that version should be published hopefully in the next month or two. All right.
And we will provide my email address and Amanda's at the end of this presentation. So if you have any questions or need to get into more specifics, feel free to reach out to us and we can talk with you more about that.
All right, so I see a question from Linda, and I think I've missed some of the questions here, so you might want to, you might look back in that, Jesse, and make sure I got them all. But when is DO 150 effective? Will managed care plans honor that definition too, or does this only apply to MO HealthNet? So September 1st, we published the provider manual with that definition, and I've reached out to all 3 plans and I've told them this is the new definition in the coverage. Actually, I talked to them, I believe last week, and clarified it because they weren't aware that that had changed. MO HealthNet doesn't consider it a change. They consider it a clarification. So nothing changed in the system, but how we just clarified it. So the plans now know what our expectations are. So they are changing with that. So I would have to just say, you know, starting September 1st, because that's when we put it out there. The managed care plans follow. Yeah, you said that. Okay, yes, they're working on it. I emailed them last week or the week before, and so they are fixing it. And then Margaret, you put D3120. What were you asking about that? Like the limitations on it, D3120. Did I write it down right? D3120. I don't, 3120.
She said that one has an X for support. You could use it as an example for support.
Yeah, so apparently this is covered for children, pregnant, blind, and people in a nursing home, right? But if adult would need this, that isn't within that special category, then it could be provided with support. Now, I mean, you have to make sure it's medically necessary. And if you have questions about that, like, oh, I just want to double check and make sure you reach out to someone here, like, you know, Jesse or myself. There is an educator over the dental program. Her name is Lee Gerloff. So she is fairly new over dental, but I've been teaching the dental program for more than 8 years. So I could probably answer any question you may have about MO HealthNet's coverage. All right.
Then there was one more question. Is the limited exam still 1 every 2 years?
Yes. And that's for everyone. The limited exam DO140 is 1 every 2 years for everybody. Now that's something they're looking at, but it's right now that is the policy. Will we be following each managed care plan's individual limits, frequency, and rules, or do they all follow the same rules? So they should, okay, well, every managed care plan is different. They should follow the basic benefits that we outline with MO HealthNet. So they should all provide the same level of benefits. However, they all could have different rules around how they do things, like prior authorizations, that type of things, or documentation that they'd want. But the frequency and limitation rules should still be the same. I mean, because that's based on benefits. But if you find that there is an issue, you can always let me know. There is a managed care help, managed care communications email. The girls that answer that email are within my unit, within education. So if a provider is having a problem with one of the managed care plans, and they've tried to resolve it with the plan and they're just not being successful, you could reach out to our mhd.mc communications email. And Jesse, if you want to put that in the chat,
Yep.
Okay, great. They can reach out to them, and what they'll do is they'll reach out to the plan and say, hey guys, this provider has this issue, right? And we need you to reach out to them and resolve it. And then we give them a time frame, and then they have to tell us what they did to resolve it. So that gives you some recourse. Like say you're having lots of denials and you don't understand why you're getting these claims denied, and this, before it paid for it, and back and forth. You can reach out to them and they will help you get that resolved, as well as you always have me as support as well. Okay, so the age limit for, go ahead.
Yeah, I put that email address for managed care communications. I also put a link to the MO HealthNet resources page. It's a provider resource guide, which there's a lot of good contact information if you're just having some general questions and just need someone to contact. So it's a good resource for you all.
Thanks, Jesse. And because I know we had limited time, I didn't go into a lot of the different resources, but we do have a lot of educational material and resources online. So before we end the webinar, I'll go out there and kind of run through some of the stuff that's out there for you. Okay, so the age limit for D1110 specifically has a different age across all three plans, for example. Well, that's not okay, right? So I don't know why. So the plans, so I can look at that. You can provide that. Send me an email, Jesse. You can have her send me an email. They can do extra things, but they can't like not give you what the basic package is. So like say they want to give you 2 DO140s in a year, and the state only pays for one every 2 years. They can do that, but they can't say you can't have DO140 within 2 years. You have to wait 3 years. They can't do that, but they can give you more services, but not less. So we might want to look into that D1110. Please give me all the information that you have, like tell me the differences, because that way I can address it with the plan. And if you have any claim samples, examples where things are denying or what have you, then we can reach out to them with those examples. That helps us get better answers. Awesome. Does anybody else have any questions right now? Looks like you've got stuff in the links. I think that was it.
Yep, I think we're good.
Okay, awesome. All right, so I just wanted to kind of go into the provider manual a little and let you know how to read it. And like I said, there's going to be a new one updated soon that hopefully will spell things out a little bit more for you. Now, what I'm going to do is go back to this provider page and go through some of these resources that are out there for you. And I also want to tell you that there's some changes coming, which is awesome because you know how long it took us to update those manuals. I think I've been working for MO HealthNet since like 2011. Okay, so there's been like multiple attempts to update that manual, and we finally were successful. It took us about 1.5 years, I think, or a year to actually get the manuals updated and changed. So the next big change that we're going to have is we redesigned our website, and I believe that's going to go live December 1st. And like if you were to go here, there's all kinds of information about all the different programs. So it's not going to be limited to dental. What we're doing is our new website's going to have, you'll click on the program. So I just want to know stuff about dental. I don't care about the optical program, right? So I'll click on my page. It's going to have my provider manual. It's going to have all bulletins and hot tips that pertain specifically to dental providers. Any educational training materials that are for dental providers will all be listed on the same page so that you don't have to go hunting for the information. So we're really excited about that launching. And of course, we're going to have lots of educational material. Like as soon as that happens, we're going to make PowerPoints that show you how to navigate it, as well as offer additional trainings. But I think you guys are going to find it helpful. And of course, your feedback is really important. So just tell us if there's something that's not working or you think we need to change something. So anyways, I'm excited about that. But all these things are still going to be out there. They're just going to be moved around a little bit to make it easier for you. So there's information on email med here. And then I'm just going to hit on a couple things that I think are helpful. So the claims processing and payment schedule, this tells you when MO HealthNet pays claims. So they have to have the claim entered on this day by 5 o'clock. And then the corresponding direct deposit is in the second column. So the date they're going to be paid is in this column. So we publish that. Sorry. Let me get back over there. So that is claims processing payment schedule. Then we have remittance advice for mark codes and claim adjustment reason codes. This is going to be for your billers. They would use this anyway if they are handling other insurance, looking at the adjustments. So an example is they have a contractual obligation. So they may see CO 45, which means that's their adjustment for contractual obligation. Say there is a coinsurance or deductible, there's going to be a code that applies to that. So those types of things have to be uniform when they're entering claims into MO HealthNet. But this is just kind of a centralized hub for lots of information. So it's just going to take you to the Washington Publishing Company. I'm going to look up here. I believe there's a question.
There is. Is there any word on the problem of Missouri managed care plans not paying the MO HealthNet allowable if primary allowable is lower?
I believe someone asked me this specific to UHC. So I've asked for some examples. And I don't know, Debbie, if you're with that office or not. If you're not with the office that sent that to me, please feel free to send me any claim details, like give me the DCNs, dates of service, the other payer information. And then I'm going to be reaching out to the plans to talk about that. Oh, well, that shouldn't be the way it is. So you want to make sure that your billed amount is going to be higher than what they're paying, right? She's saying that none of the MCOs are paying the allowable. That shouldn't be happening. So there's got to be an issue. I've heard this a couple of times and they're telling me that it was just UHC specifically. So please feel free to send me that information. I need actual examples though, because I have to go to the plan. And yes, email me the EOBs, make sure the DCN and data service is there where I can see that, and then put your MPI in the email as well. Awesome. Thank you. And that's unfortunate. I have heard it, but I've only heard it specific to the one plan, but thank you. All right. So under billing, the remittance advice adjustment, claim adjustment reason codes, this right here is important. Then we have provider forms. And because I can't cover everything today, I'm just going to mention a couple of them that are important. So we've got this insurance resource report form. This is what we call the TPL4 form. This form is if, say, you see that a person has a primary insurance and you bill that insurance because MO HealthNet's the last payer, right? And then it comes back and they say, oh, they don't have that insurance. They no longer have that policy, but we show it's active. And in order for our claims to pay, you have to bill them first and tell us, what they paid or what have you. So this form right here is allowing the provider to report that this insurance is no longer valid. And we have a contractor that looks at this and they verify whether that insurance is good or bad, and then they remove it. The same is true is if they have an insurance that we don't know about, and you know about it, and okay, I'm going to make sure to bill them because what's going to happen, we'll come back eventually or potentially come back and say, hey, you needed to bill the primary once we realize they have one. So you can add that insurance as well. This form, you just complete it and email it in, and then they'll review it and process. This process takes a little bit longer than some other processes. So I believe they had 2 to 4 weeks on here. I think it's closer to 4 weeks. But it is still a valuable resource because a lot of you are seeing the same patients, right? You'll see the same patients. And if you guys have questions about filling these things out, feel free to reach out to me or to Lee Gerloff. She's the education rep. Now, another form, if you see fee-for-service patients, could be the spin down form. And there's a lot of, I have some resources available to you so that you can look at this. If you have questions about how spin down works and what that is. Now that's not going to affect people in managed care. It's only going to affect people in fee for service. Okay. Something else, there's a prior authorization. If this is specific to fee for service, so if a service requires a prior authorization, this is the form. And then this would need to be mailed in with all the documentation. I believe those are the forms that I bring to your attention. Looks like, I think we have something in the chat.
I just put Lee's email address in there also.
Okay, awesome. All right, so here is the fee schedule. So I'll go ahead and click on the fee schedule. You accept all this stuff, hit accept. Now there's two different ways you will search the fee schedule. You have a download option, which I don't recommend that you go in here and use this very often, but you can go in and click the Excel document. There's a lot of information out there. Most of the time it's like clearinghouses, dealing with different software, they use this information. But I always tell my providers to use this full search option. You'll come in here, you'll click on the program. So we're looking at dental, and say I want to look at DO120. I want to look to see how much that pays and if it's covered. So right now it shows $48.80, which is awesome compared to what it used to be. It was like $24 or something before. So we had that significant rate increase, which is awesome. So what can you see from here? So you got your code specifically. So if you hover over it, it tells you what that code means. Okay. Then you've got this a pricing indicator. If you hover over it, it tells you what it means. A 3 means payable. You may see a 6, which means manually priced, and a 9 means do not pay. It's a non-covered service. But like I said, you can hover over it. It'll tell you, as well as there is a MHD price file key down here that will give you, tell you what all those different things mean. So if you were to look up this code, you'll say, oh, this is a covered service. Now, what does this not tell you? It doesn't tell you the limitations around it, right? It doesn't say, oh, adults don't get this if you're in the limited benefit. It doesn't tell you that. So what is the purpose of this? The purpose of this is tell you how much we pay for it and if it's covered. Does MO HealthNet pay for the service? All right. So you still need to reference the provider manual. Now, eventually you'll have an idea of, after a while, what's covered, what's not covered. But, you need to always reference Section 5 of the manual to make sure that whoever qualifies for what. Looks like there's a couple questions out here. So Linda, you're asking, okay, we're making all these updates and changes. Prior authorizations for fee-for-service currently have to be handled by mail. That's not changing. This is something that we've asked about a lot, through the years. Providers have asked about it a lot. So I believe like their thinking originally was like 75% of our population moved to managed care, and managed care plans have their technologies better than ours, right? So it would cost a lot of money for us to change that process. However, we are looking at it. We do have a team that works on it. We have a committee that's working on trying to get a new software or new system for all Medicaid prior authorizations that would include every service. So we're trying to figure out a way to transition that, but that's like a work in progress, and we all know that takes a while. So I don't promise my providers anything. I just tell them, okay, this is where it's at right now. But I don't see it changing anytime soon, because like they told me, okay, well, if we have all these people in managed care, is it really worth that and changing all of those things for that small group of people? Because, they have to weigh the pros and cons. So yeah, you still have to mail it in. Sorry. And then Melissa, how does it work if a patient is on presumptive eligibility? So would be fee for service for treatment that prior authorization is required. So many times we start with fee-for-service guidelines, and once the application processes, they're then in a MCO. So are you having problems because of that? Like once they transition to the managed care plan, they're not honoring whatever you started doing? Or are you like going through the process thinking they're fee-for-service, and then all of a sudden you're surprised that they're changed to like a managed care plan? Because we want to make sure we want to check eligibility on every date of service. So when you look at eligibility, they could have been something yesterday and changed today. But I can see like in a prior authorization situation, there should be a coordination between MO HealthNet and the managed care plans. But sometimes there's a little bit of a breakdown. So She said, yes, when we start PAs under fee for service, then in the middle of the process, the client moves to MCOs. Well, I mean, they're supposed to work with you on that, but I mean, if you're experiencing a lot of issues, you know, we can look into it on a specific, you know, case by case situation. I'm trying to make sure I catch all of your stuff. You've been waiting on the MCOs to be assigned, which causes delays. I think like for some reason I thought there was like a 2-week waiting period. Once they become eligible, then they switch to the MCO, but it just really depends on what type of coverage. But presumptive eligibility, I didn't think presumptive eligibility covered dental. I thought it was more limited. But we might just look at the specific situations that you have. If you want to provide some examples, that'd be great. Ryan, is it better to file claims via EmoMed or just paper claims in the mail? Oh no, don't mail them. You want to put them on EmoMed. Now remember, EmoMed is used for fee for service claims. EmoMed is super easy to use, which I didn't have time to go into today because they just kind of wanted me to do an overall, you know, benefits and who gets what. But there are training materials out here for you that helps you enter those claims. But remember, it's only fee for service, EmoMed. And please don't mail your claims ever. Like you can, but don't. It takes a long time, and there's so many different fields on there that there's more room for error. Now, sometimes we require it, like say we need an x-ray for something and we want it with the claim, then you mail it in. But for the most part, you don't. Hopefully that answered it. Melissa, you said it does cover everything that the standard coverage will cover. Oh, you were just saying you agree. Okay. All right, good questions, you guys. And let me know if I didn't answer your question and you want me to clarify it more. And Jesse may be able to unmute you so you can actually ask the question. I don't know what the limitations are set on this webinar. So I'm going to go back. Do what?
I said if they want to use the raise your hand option, if they raise their hand, I can go in and unmute them if they want to ask them out loud. I also wanted to let them know that there will be a dental billing webinar December 5th, where they'll walk through EmoMed and go through claims and how to process those. So if that's your type of question, that is coming up December 5th. We can send a link out for that after the webinar.
Awesome. Thank you. Thank you. All right. So I just wanted to go through a couple of those things, the fee schedule. This is the education and training resources, which is awesome, I think, you know, but I'm in education. We have a provider training calendar as well as like a PDF out here where you can find a dental training, which Jesse was referencing right here. You can just click on that and register. Lee Gerloff is going to be the trainer for that. If for some reason, say your office is having a lot of issues, or you really just want to take some one-on-one time and talk to one of us, you know, and ask questions specifically for you, you can reach out to one of us and we will just set up time to talk to you and work through whatever claim issues you're having. Now, we are kind of limited when it comes to managed care. However, I work with the managed care plans directly. So if we see some issues going on, I could reach out to them. So you can sign up for one of our trainings, as well as there's different resources down here. This is general resources, which I kind of went through, you know, like the webpage and some of the different services or places, you know, you can go to find information, but there's like little PDFs or PowerPoints out here for you to look at. If you're questioning, how do I look at eligibility? There's a PowerPoint out there that talks about eligibility and spend down, EmoMed overview, like how do you use EmoMed? But then I also have something specific to dental providers. So there's a PowerPoint out here that's got tons of information in it. Now, the policy manuals have changed, like where things are. So some of those references are a little bit different now, but I kind of ran over some of that with you. And if you have questions, let me know. But we're getting ready to update all that with the website. Like when that's updated, we're going to change everything. So that's going to give you some billing samples as well, which is like at the end. Like it tells you how to enter a claim on EmoMed, you know, like how to enter secondary or how do you enter primary to MO HealthNet, and it tells you how to do all that. Especially people have a lot of issues when it comes to like Medicare replacement plans, like a Part C plan. So I have detailed instructions out there to tell you how to fill out those claims. All right, some other stuff, contacting provider education. And Lee, she's the one over dental, but we gave you her information. Provider resource guide. Jesse referenced this a minute ago, tells you about our program, but has lots of different resources for you, as well as it tells you what all these ME codes mean, which I still reference that when I have questions. Benefit tables. This is helpful, especially for like new staff or people making appointments to kind of know, oh, wait, so what ME code is limited and which one's comprehensive? So I kind of like, okay, do they have a dental benefit? Yes, they do, right? But they're going to have a limited benefit, and there's going to be information down here that talks about that. All right, so this is helpful for people scheduling that just kind of need a quick reference. All right, but I think I've covered most everything. There is this over here that's MO HealthNet News. This is like a distribution list we ask our providers to sign up for so that we can send you information like, say, the provider bulletins, like the wonderful rate increase that we got, right? That dental providers received. We would have sent a bulletin out telling you, hey guys, here's the rate increase, and give you information about, you know, how we're reprocessing the claims. So that is an important thing for you to sign up for. All right, Jesse, I think that's everything that I'm going to cover today. Do you want me to go into anything else?
Let's see if there's any questions out there, anything we can field. We only have about, probably 4 or 5 minutes left. We want to be respectful of your time. If there's anything we haven't covered or any questions you have, please let us know in the Q&A box, so we can talk about that real quick. In the meantime, I want to share a link with you. I'm going to send, this is the link to the Missouri Coalition for Oral Health webpage where this recording will be added. There's also the other webinars we've done on Medicaid. There's some resources for dental providers. So please feel free to check that out. We'll include all these links with the email that comes out here shortly after the webinar as well. I know it's frustrating to put all these links in chat, and then once the meeting closes, they're all gone. So we will send those out in the email afterwards as well. I also sent a link to a resource we have developed called the 3 Steps to Determining Eligibility and Reimbursement. It's kind of just a step-by-step guide on everything Amanda has covered on verifying their eligibility, checking the benefit table for coverage, and then finding which procedure codes they are eligible for. Okay, there was a question in the Q&A. How long is the rate increase in effect?
Well, we don't see there being a change in that at all. So it's not a limited thing. I mean, we don't think it's going to change because it took a little bit for it to happen, but you know, we see that there's some positive effects from it, of course, because we're trying to recruit more providers because our rates are high enough, you know, in compared to the private insurer or commercial insurance, so they're comparable. So we do not anticipate that we're going to lower those. I just don't think it's ever going to happen.
Yeah, so that's been a common concern among providers that I've talked to. And in real life, when you look at the state budget and the small portion that is dedicated to the dental Medicaid, it's such a small portion that it would be very surprising to see that rate rescinded. There would be a lot of other cuts before they would address something like that. So it's not something that we see in the near future. If anything, we plan to advocate for more rate increases and more services. So it's not something we anticipate that will be rescinded anytime soon. Any other questions or concerns we can address? Anything from providers that you're seeing that are barriers or issues you may have? We know that understanding coverage and being able to determine who's eligible and what's covered is one of the big barriers for providers. So getting this information out there and trying to make it as user-friendly as possible is wonderful. If you have questions, please feel free to reach out to us. We want you to have a pleasant experience being a Medicaid provider. We want you to be paid, and we want these patients to receive the care that they need. All right, well, we have 1 minute left. If anyone has any last minute questions, we will address those here as we close out. I want to thank Amanda for being here today and sharing this information. Amanda is a wealth of information, especially on the dental Medicaid program. If you have any questions, feel free to reach out to me or Lee or Amanda, and we will get those questions answered. Again, we know that the provider manual isn't always clear, and we want to do what we can to make that better for providers. If there's anything we can answer for you, please feel free to reach out to us. We're here to help as much as we can.
And please forward those examples of issues that you're having. I'll definitely address that with them as well as respond to you.
Yeah, so anytime you're emailing Amanda, it's very helpful, and we will get answers to you quicker if you can submit examples, claims information, MPI, participants information, which health plan are you working with. Having those details up front will help us get you those answers a little quicker. So when you're emailing Amanda, feel free to include all that information. All right, well, thank you for being here today. I'm going to put a survey in the chat box. We'll also send it out in the email. Like I said, your feedback on these is very helpful. It helps us know what we're doing right, what we're doing wrong, what we can do differently. We appreciate your feedback, and we do look at that and take it into consideration with other upcoming webinars. There is another Realities of Medicaid webinar coming up in 2 weeks, where we're going to have Dale Carr here talking about MMAC and their audit processes. We know that's another concern for providers. So he's going to be going over that audit process, how they determine who gets an audit and what they're looking for. So that'll be a great webinar to attend. If you haven't already, we highly recommend you sign up for that one as well. Well, with that, we will close out for today. Thank you for being here. Have a wonderful Friday, and we hope that this has been helpful. Feel free to follow up with us afterwards if you have any questions.